This is June. Happy New Year. Welcome to my fourth part of the nursing thing. Sorry it's taken so long. It's been a long time with the holidays and everything. My time just went. I don't know if anybody else's time went, but my time just went. But I was coming back to give you guys step four of the nursing program. We started with CNA and then we went to associate's degree and then we did the bachelor's degree. And now I was bringing to you the master's degree, which is in different. I will break it down. I did write some notes. So if I look aside, it's because of looking at my notes. But there are many master's programs that people do and I'll break each one of them for you guys, and anybody can see which one it is that you would want to do. So first we have a master's in what we call adults gerontology, that is taking care of adults and older adults like 75 and above. So that's one master you can decide. There are people who love geriatrics and all they want to do is take care of geriatrics. That is a master's that you can do on its own. It has a certification. After you finish, you can prescribe medications, diagnose these patients, and take care of most of the things. If they are complex, you work with a MD to find out, or specialist. Let's say you came up with something that is out of your reach, like urology, you send to a urologist, something to do with the kidney that you've tried to figure out everything, or they went into stage 5 kidney disease, which is end stage renal disease, then you will be in conjunction working with a nephrologist who is a doctor that takes care of the kidney. And then we also have acute care nurse practitioners. That is a master's that you do. It takes 2 years too. But this ones mainly work in the hospital. That's where I see them taking care of patients in an inpatient setting. In most cases, hospitals or emergency rooms. We do have those emergency rooms. Acute nurse practitioners will do the program, and then some of them will certify themselves in emergency medicine and then work in the emergency department. But any acute care nurse practitioner masters can land you into the hospital. Those ones are strictly hospital. If they do work elsewhere, surgery center, but inpatient, somewhere that is, where patients come in and go. That's mostly where the acute care nurse practitioners work. The next one is family nurse practitioner. That's a general one that you see anywhere from 0 to 99. And you take care of kids, teenagers, adults, and then geriatric population. So this one is open to somebody who wants to do the whole life spectrum, but the other ones are into categories. So if you want to do family, then you're taking care of 0 to 99. And I'm limiting 99. You have patients that are 106 that are still alive. So anywhere from 0 to 100 and whatever. And it is diagnosing, assessing the patient, prescribing. That's what it is. 2 years master's program, and you can get this done. Another one is psychiatric nurse practitioner. This one's also see a wide range of population, but theirs is mental health and substance abuse. So they take care of the person as a whole, but they focus on the mental health, substance abuse of the patient. Um, 2 years program too. It's a master's. It's a 2 year master's program. You don't have to do 2 years. If you have 2 years, you can do it. There are people who do it part time and it takes longer, either 3 or 4 years. But if you're going straight school and working just a little bit, then 2 years is the way to go. But if you're working, have family, and you want to go slow, then when you do it part time, it ends up being 3 to 4 years. That's psychiatric mental nurse practitioner, takes care of patients' mental health. They diagnose, they treat, and they also do substance abuse, because substance abuse is also under mental health. Another one is nurse educator, 2 years master's program, regular master's program. These people are educators, whatever it is, diabetic educators, psychiatric educators. They are also, the way I have experienced them is in hospital inpatient settings, where they have, in the hospitals, you have floors or departments, as I may call them. So they're in the cardiac department, and all they do is teach the nurses about cardiology. And then you have the ones who are in the hospital, and all they do is going around talking to diabetic patients about diabetes. So they are educators, but now the ones who do diabetes have certified themselves in diabetes education and speak to the patients about their diabetes, and coach them through the disease, eating, everything, the whole 9 yards. So mostly I see them in hospital settings. Then you have executive director. This one's their masters is in management. So mostly they manage facilities, so to speak. Health facilities administration, mainly hospitals or hospital units, because some hospitals are huge. They need a director of nursing, and then they have an educator under them, and then they have an what do I say, executive director. So mainly inpatient facilities, and inpatient doesn't mean hospital only. It means all the other. There are those who go to skilled nursing facilities, and then there are those who are administrators at these skilled nursing facilities. But then, if you're an administrator at a skilled nursing facility, you have to get the certification to be an administrator too. But mostly, if it's just executive director, most of them are in the hospitals, also requires a master's degree. Some of them will do masters in combination with an MBA to make them more marketable. So they'll get a business administration degree to make them more marketable. The other one is neonatal nurse practitioners. This one's work with the tiny, tiny babies. Hospital. This is only a hospital setting. You cannot do neonatal nurse practitioner anywhere else. Hospital setting or clinics if the patients have been discharged. But neonatal are babies that are born before their time. So mainly it is in a hospital. And this, all they do is take care of babies. We have huge hospitals that have just neonatal areas. Presbyterian St. Luke's is one of them. Lots of hospitals. Every state has a hospital that is babies that were born before their time, stay in the hospital, taken care by these neonatal nurse practitioners, take care of them until they are able to get out of the hospital. So those are neonatal nurse practitioners. They do a master's degree, 2-year program, hospital based most of the time. The another one that I have is pediatric nurse practitioner. And this is babies now, not little babies that are born before their time. These are little kids from 1 year and above, or since they are born, and all they do is peds. Peds mean pediatric, small kids. They take care of the small kids, take care of them, diagnose, assess, prescribe. They can do everything pretty much, and that's their forte. That's all they do. So those are the main ones that I can think about. I'll recall all of this. Adult gerontology, take care of adult and older patients. Acute care nurse practitioner, mainly hospital. They can be out of the hospital, but mainly hospital. Family nurse practitioner, 0 to 100, and where the patient gets old, whatever the age is. We have 110 now. So anywhere 0 to 99, that's a more wide variety. You can decide to take care of one half of it, but when you go to renew your certification, you're asked what happened to this other half. You see 0 to 99. Why have you seen 50 to 100? Where are these other people? So be careful if you do family and then you specialize and just do adults, they'll get hold of you. And then you have psychiatric nurse practitioner, mental health, substance abuse, mental health, take care of them, diagnose, assess, prescribe, counsel. That's what they do. The other one you have is nurse educator. They can be in the hospitals mainly. They can be anywhere else, even surgery centers, and all they do is do teaching with the patient, teaching with the patient. A good example of nurse educator is diabetes management, where they are teaching patients about their diabetes. That is why it's always an inpatient center for most cases. The other one we have is executive director. They do lead organizations, huge organizations, hospitals or nursing homes or whatever it is. If you do a nursing home, you need an MBA. Most people do get an MBA administration kind of degree to be able to run the nursing home. So nurse educators, executive directors, mainly in the hospital, doesn't mean you'll not see them anywhere else. You can. Another one is neonatal nurse practitioners. In my experience, mostly hospitals, because those are babies that are born before their time. And then we have the last one, pediatric nurse practitioner, and those are children who are born, take care of them, diagnose them, something. So all these master's programs, if you're going full time, it's 2 years. If you're going longer than full time, then it takes 3 to 4 years, whichever is your schedule, whatever works for you. These are the main ones, guys. If I think of anything else, but these are the main ones. There are always new ones coming up. It's evolving. It's an evolving profession. So there are new ones that are coming up. But if anything else comes up, I will let you know. But this is the fourth of the steps we take in nursing school. There's a fifth. There are people who go for doctorates, and those is education. But the doctorates mainly, if you want to teach, it's a good route to go. And there are people who do research. There are people who love research, and all they do is do the doctorate because they want to research a certain program and make it live. So doctorate is another step. I won't cover that. My last area of covering is the master's degree, but you can do a doctorate if you want to. Doctorate is good for those who love teaching, research, amazing program, and you can have doctorates in a wide variety of things. I wish you a happy 2023 and more videos, more time with you guys. Thanks for watching.